Hello friends, welcome to my YouTube channel. This is Dr. AMEESHREE Yagnik, and today we are going to discuss about gynecology and homeopathy. In this session, we will learn about the difference between gynecology and obstetrics. Along with that, we are going to learn about the different conditions related to the gynecology in which the homeopathy is useful, as well as we are going to learn about the conditions related to the pregnancy in which homeopathy is useful. Along with that, what can be the homeopathic approach in the gynecology and obstetric conditions, means what are the questions you will be asked if you are going to consult a homeopathic doctor for gynecological and obstetric conditions. So let's begin. Gynecology, it is a branch dealing with the diseases of woman's genitourinary tract like ovaries, uterus and fallopian tubes. It is only related to the diseases of the woman's genitourinary tract like ovaries, uterus and fallopian tubes. While obstetric, it is a branch that deals with pregnancy, childbirth and postpartum period. Postpartum periods means period after pregnancy, after the delivery of the child. Scope of homeopathy in gynecology. First, premenstrual syndrome. This is the most common problem faced by every woman. So PMS syndrome, it consists of breast pain, abdominal pain, weight gain, mood swings and headache. Menstrual problems, irregular periods. Then there are the menorrhagia. Menorrhagia means excessive menses. Dysmenorrhea. Dysmenorrhea means painful menses. And menstrual fatigue. Menstrual fatigue means exertion during the menses. Perimenopause problems. Okay, perimenopause problems means a problem which is related to the menopause or which is occurring. These are the problems which are occurring before the starting of the menopause period. Okay, so what is menopause period? So complete stoppage of menses. Menstruation stops after prolonged period of appearance. Menopause occurs in females at the age of around 40 to 45. Even in some of the females it can be late. It is at around 50. So what are the symptoms which will appear during the menopause or before the starting of the menopause? That is hot flushes, means excessive feeling of heat in the body, then heavy periods, then variable blood pressure, palpitation. What is the meaning of palpitation? Palpitation means one can feel their own heartbeats. That is known as palpitation. Sleep disorders, uterine fibroids and ovarian cyst. All these are the conditions in which homeopathy will be useful. Pregnancy related issues. So morning sickness. Morning sickness means whenever you wake up in the morning during your pregnancy, you feel like vomiting, nausea, all that things, uneasiness. So that includes in the morning sickness. Then constipation and piles. Then heartburn. Then insomnia means sleeping disorder, you cannot sleep for the long, that is insomnia. Then low backache. Then there are the varicose vein, which means engorgement of the veins. Okay, postpartum depression. Depression, this is the most common condition which occurs after the pregnancy. So after the baby is delivered, there are kind of symptoms of the depression occur in the female. So that is postpartum depression, in which homeopathy is very useful. Recovery from CS and episiotomy means after the cesarean section, the healing will happen very quickly if we are opting for the homeopathic treatment. Okay, episiotomy, it is also in this condition also homeopathy is very useful. Breastfeeding problems. So once the child is delivered, then there are issues with the breastfeeding. So the conditions in which there is lesser amount of the milk secretion in female, so homeopathic medicine can help in increasing milk supply. Breast pain and mastitis. Then fatigue due to breastfeeding. Generally females should not get tired of nursing their child, okay, but if they are getting tired, then it is a problem, and in this situation homeopathy can be useful. Cracked or bleeding nipples, medicines like borax is useful. For increasing milk supply, medicines like leccan are useful. Recurrent genital infections, that is vaginal yeast infection, that is a fungal infection in the vagina. Then genital herpes, again it is a viral infection. Condylomata, it means warts in the genital region. Then acne flaring up before menses, means pimples occurring on the face before menses. In this situation also the homeopathy remedies are useful. Medicines like dulcamara as well as berberis equi, this can be useful. Then homeopathic approach in case of gynecological cases. So what a homeopath should ask to the patient and what a patient can expect that homeopath will ask. So chief complaint, a complaint which is bothering you the most is the chief complaint. Then onset of menarche and menopause, menses, first time appearance of the menses is very important, and when the menopause started is also very important. Days of cycle like 1 to 5, then duration of the periods, right? Then quantity 20 to 80 ml is normal, and this can be noted by the number of pads per day. If you are using 1 to 2 pads per day, then it is normal, but if you are using 4, 5, 6, 7, then it is abnormal, means you are suffering from the menorrhagia. Color, it is dark red, bright red, maroon, black, clotting. These all are very important from homeopathic point of view in differentiating the remedies. Okay, then blood is clotted or not, so that is also very important. Odor, a smell of your menstrual discharge, very important. Whether it stains or not, it is also very important. Color of stain, whether it is black, brown, maroonish. So all these things also helps in differentiating the homeopathic medicines. Complaints before, during and after menses, these are known as concomitant complaints, so it is very helpful in differentiating the homeopathic medicine and getting your best remedy. So whatever complaints, say for example, if you are feeling pain in abdomen, if you are feeling constipation before menses, then it is very important. During menses, pain in abdomen and diarrhea, nausea, vomiting, anything, etc. And after menses, if there is exertion, etc. Okay, like backache, abdominal pain and body ache, etc. These all are the complaints which can happen before, during and after menses, and this is very useful from homeopathic point of view to find the remedy. Then body ache, okay, then leukorrhea, that is white discharge occurring from the vagina. That to the time is also very important, that is before, during and after menses. Then consistency, then quantity, odor, itching and bleeding, etc. of the leukorrhea is very important from the homeopathic point of view. Okay, now homeopathic treatment is given on the basis of person, not on the basis of disease, and this does not mean that disease symptoms are not important. They are also considered, but based on individuality of the patient. So in order to achieve best result in homeopathy, person's every minute detail is very important, like his personality, behavior, thoughts, feelings and action he does. Then physical generals like thirst, appetite, hunger, desire, aversion, ailments from, etc. Interpersonal relations, relations at work, performance, thermals, etc. All these components together forms the constitution of person, and all these details helps in finding out homeopathic constitutional medicines of patient that may lead to cure. Best way to achieve cure in any of complaint is to find out the constitutional medicine of the patient. Ideal way to find out constitutional medicine is to consider physical and mental generals, particulars, miasma, concomitant, in short, taking case of person as a whole and preparing totality of symptoms to reach up to the constitutional remedies. Okay, Thank you. I think this video will be useful to the patient as well as novice homeopath who are just budding up in this field of the homeopathy. If you like this video, please do like, share, subscribe. Thank you. Thank you very much.